Hi, everyone. Apologies for that delay. I'm going to turn it over to Leticia to introduce Representative Pressley.
Hi, everyone. Thank you for your patience. My name is Leticia Salazar, and I am the editor-in-chief of Penn Law Review. I am so honored to introduce our keynote speaker for the symposium, Congresswoman Pressley. We are so excited to further the conversation surrounding the disability frame with her remarks, and we are thankful for her participation. Congresswoman Ayanna Pressley is an activist, a legislator, a survivor, and the first woman of color to be elected to Congress from the Commonwealth of Massachusetts. Throughout her career, Congresswoman Pressley has fought to ensure that those closest to the pain are closest to the power, driving and informing policymaking. In Congress, she has been a champion for justice and healing, reproductive justice, justice for immigrants, consumer justice, justice for seniors, justice for workers, justice for survivors of sexual violence, justice for formerly and currently incarcerated individuals, and healing for those who have experienced trauma. She has also turned her experience living with alopecia into action, becoming a leading voice fighting to raise awareness and support for the alopecia community across the nation. Congresswoman Pressley currently serves on the House Committee on Oversight and Reform and the House Committee on Financial Services. Prior to being elected to Congress, she served on the Boston City Council for 8 years and was the first woman of color elected to the council in its 100-year history. Now, I will turn it over to Representative Pressley. We are so thrilled that you are here, and we look forward to our conversation. Thank you.
Absolutely. Good afternoon, everyone. And thank you, Leticia, for that incredibly gracious, warm and kind introduction. I want to begin by recognizing and thanking the University of Pennsylvania's Law Review for extending the invitation to join you all for this insightful and powerful symposium. Thank you to Dean Ruger and Professor Tani and Harris for helping to make today possible. It is wonderful to see the Law Review be so intentional about centering disability rights and justice. It is incredibly timely. It is essential, critical, and quite frankly, incredibly long overdue. So it is my privilege to join you in virtual community, all of you. And I want to thank those who have been working on the front lines, sounding the alarms, calling the questions that change the conversation and advance our collective work. The pandemic has made it clear that we are still very much in the civil rights movement. Although history would lead us to believe the civil rights movement was that Rosa sat and Martin spoke and John crossed a bridge and overnight our full liberation was recognized, we know that is not true. We are absolutely still in the midst of the civil rights movement, and disability rights and justice is a key and central aspect of this ongoing fight. More than 31 years after the historic victory that was the Americans with Disabilities Act, we celebrate the foremothers, fathers, and non-binary siblings of the movement, while also affirming that this fight is nowhere near over. As Coretta Scott King once said, freedom is never really won. You earn it and win it in every generation. And in this moment, the stakes have never been higher. Over the last 2 years, the public health crisis has laid bare the deep inequities and disparities and racial injustices that have persisted across the nation. We have witnessed firsthand the deadly consequences of generations of chronic disinvestment, disenfranchisement, and policy violence waged on our most vulnerable and historically marginalized communities. The deadly consequences of a lack of universal and quality healthcare, a system which prioritizes profits over people, and discriminatory policies that aimed at limiting access to care for people with disabilities. The deadly consequences of systemic racism and ableism that resulted in Black, Brown, disabled, and immunocompromised people bearing the disproportionate burden of this pandemic and so often feeling expendable. The deadly consequences of chronic underinvestment in affordable and accessible housing, our home care infrastructure, and Social Security safety net, and so much more. The stakes have never been higher, with millions having lived through COVID-19 and now facing prospects of life with long COVID symptoms. We're in the midst of one of the largest mass disabling events in our nation's history. There simply cannot be a return to a pre-COVID status quo normal, because that normal was fundamentally unjust and inadequate to begin with. We must be unapologetic in demanding a just and equitable recovery, one which centers the dignity and humanity of all people. Unapologetic in demanding policies and budgets that affirm that, yes, Black disabled lives matter. Unapologetic in our demands to strengthen the nation's social safety net, finally abolish disabled poverty, and so much more. So how do we get there? We get there by recognizing that people don't live in big check boxes. We live in nuance and intersectionality, as should our policies. Disability justice is not just one bucket of policy. It is a critical lens and frame that must be brought into every single policymaking and decision-making table. We get there by convening conversations like these with experts and future legal scholars like yourselves, advancing the work and getting into good trouble in pursuit of true justice and liberation. By recognizing and naming the pain and speaking plainly about discrimination and marginalization that the disability community faces, what it's like for many in the community to face marriage discrimination, housing discrimination, and to be dehumanized by structural policies. And in the same way that generations of policies have enacted unprecedented hurt and harm, we can and must be precise in legislating healing and justice. I hope that you will see me as your partner and sister in solidarity in this struggle. I hope you will continue to engage me as an elected official, to hold me accountable, and as a co-conspirator, to use my platform to help advance this work. For me, this is personal. When I revealed my struggle with alopecia 2 years ago, the disability community embraced me. The love, support, and acceptance from the disability community helped to ground and fortify me for the fights ahead. Together, another world is possible. We can build a more just and equitable world. Together, we can meet the moment, center individuals who are most impacted, and rebuild a more just nation if we see disability as part of the continuing struggle for our full civil rights and liberties. We are still in the civil rights movement. Let's get to work.
Thank you so much, Congresswoman Pressley. I think a big theme in what you've said is that the stakes couldn't be higher, and there's a lot of work to be done moving forward as far as addressing a lot of these issues related to disability. And that really connects to the first question that I have prepared for you, which I'll begin with now. So you have sponsored or co-sponsored a diverse and exciting slate of proposed legislation. Issues that you have focused on include preventing eviction, providing mental health support to people in need, securing family and medical leave for part-time workers, and protecting the economic security of Medicaid beneficiaries. And this is just a sample of what you have helped to put forward. When you think about your work from a disability justice perspective, are there initiatives that you are most proud of? Are there issues that you have not yet had a chance to design legislation around, but that you recognize as important to the disability community?
Well, Leticia, as I was submitting in my remarks a moment ago, I firmly believe that our destinies are tied, and people don't live in big checked boxes. We live in nuance and intersectionality, and our policies should really reflect that reality. You know, as a voter myself, I found it very frustrating when lawmakers have single issued my community. So from my work to push for a more just and humane criminal legal system through my People's Justice Guarantee, to creating safe and nurturing school climates for students through my Ending Push Out Act, to my ongoing legislating and advocacy for an equitable COVID response, the disability community is really been centered in all of these legislative efforts. So let me be clear, the mass incarceration crisis and the public health epidemic that is police violence is a disability justice issue. people behind the wall are 3 times as likely to have a disability. Half of all people killed by police are disabled. Freddie Gray, Laquan McDonald, Kevin Matthews, Tamir Rice, Eric Gardner, Charlena Lyles, Sandra Bland, Quintonia LaGreer, Stefan Watts, Corinne Gaines, Natasha McKenna, Eric Smith, and Daniel Prude are all Black and all disabled victims of state violence. So there is no justice which neglects and overlooks disability. I've introduced legislation to end the federal death penalty, which disproportionately harms Black and brown folks with disabilities, to fix our broken clemency system, to reduce mass incarceration, to end qualified immunity, to help hold police accountable for unspeakable violence born on our communities. And my Ending Pushout Act, which recently was the topic of a congressional hearing earlier this week, will create safe and nurturing school climates where all children can learn and thrive. Long before the pandemic hit, Black girls, and especially Black girls with disabilities, were most likely to be criminalized, pushed out of the classroom by discriminatory and overly punitive school discipline policies that push them into the school to confinement pathway. So now more than ever, our kids need schools where they feel safe and they can thrive. My Ending Pushout Act would support schools that abandon these discriminatory policies and harmful practices like seclusion and restraint, and instead invest in trauma-informed supports, restorative justice programs, and mental health supports. Now, earlier in the pandemic, in partnership with organizers and disability advocates across Massachusetts, we were able to push back against harmful crisis of care standards that were proposed by our governor that would have literally weighed the value of a life in scenarios where medical care is racial disparities we knew to be true across our healthcare system. They also took aim at the disability community, making plain that those with disabilities and chronic health issues would be deprioritized for life-saving care. And we were collectively able to successfully push back and revise these dangerous protocols and to save lives. An area I'm currently digging into is ways to legislate supports for the millions that are living with long COVID. The disability community said early on that this stood to be a mass disabling event. And in fact, it seems that we could have a second pandemic. But the disability community called this from the outset and said that this pandemic could be a mass disabling event, and our systems were already underfunded to begin with. We need to make sure that folks can access care and benefits. Workplaces will absolutely need to adapt to meet the needs of disabled workers. And I recently held a roundtable with impacted folks and led an effort to push the CDC to begin collecting data on the prevalence of long COVID. You know, we can't manage what we don't know. That which gets measured gets done. So we need this data so we know how many folks are impacted, we can spot the disparities, and most importantly, understand the range of systems so that we can get folks the care and support that they need and deserve.
Thank you. This is Leticia Salazar again, moving on to my second question. And it's related to the one that I previously asked you. So you have also taken up big areas of law reform, such as healthcare, immigration, sexual violence and sex work, civil liberties, criminal justice reform, and public transit and infrastructure. And as you mentioned during your first answer, a lot of these issues disproportionately affect Black and brown individuals. You've given thought to the ways in which disability can compound other forms of discrimination, but not everyone understands disability the way that you do. What is necessary to ensure that disability reform is prioritized within these big areas of law reform, especially when it is often seen as niche or exceptional and not a big issue? And if disability concerns slip through the cracks or get negotiated out of existing law reform efforts, what can disability activists and other on the ground do to assure that these concerns, priorities, and perspectives are included in the legislative reform work?
Well, you know, we can't offer prescriptive solutions to anyone's pain if we don't first name it. You know, and so we have to actively listen to and be led by and name the pain. And that means calling out these disparate outcomes and the racial injustice, and And until we name it, until we understand it, and believe the lived experiences of Black and Brown folks, we won't realize the progress that is necessary. We can't move towards a vision of disability justice without speaking plainly about the discrimination and marginalization the disability community faces. You know, to be Black, and certainly to be Black and disabled, I think is this very unique and painful dichotomy of both hyper visibility and invisibility all at once. So we have to speak plainly about the discrimination and marginalization of the disability community, what it's like for many in the community to face marriage and housing discrimination, to be dehumanized by structural policies. We have to be intentional. We have to be intersectional in our organizing and our coalition and movement building. The stronger the coalition, the stronger the movement. But the honest truth is that the power of the people, and I learned this from my mother, the power of the people has always been stronger, has always been greater than the people in power. And that might seem a contradiction or ironic that I would say that, since technically I am in one of these seats of power, but I'd like to think that's because I know where the real power lies. And that is with the people, that is in the movement. And there are good faith partners in government committed to the work. And I hope that each of you will see me and my team in that way. Find the champions that are willing to throw down and lay down their bodies on the line, just like so many in the community, to the final minutes, and not concede defeat easily, or ever, because lives are quite literally depending on the fights that we're willing to take on. Congress doesn't lead, it responds. That's the truth of the matter. And so daily it falls on the people to apply the political pressure so Congress can show some political courage.
And transitioning to my final question, which touches on a few of the things that you have brought up, specifically the intersectionality between Black and disabled folks, and also the effects of long-term COVID. So the current pandemic has disproportionately and negatively affected communities of color and people with disabilities, as well as those at the intersections. We see this, for example, in crisis standards of care that discriminate against people with intellectual and developmental disabilities, as well as in the poorer quality of care that African Americans and those with disabilities receive related to COVID-19. One critical question that you've raised is that long COVID and what this means for marginalized communities. In July, President Biden stated that long COVID could be a disability under existing disability laws, followed by the issuance of federal agency guidance on long COVID. Are there any specific bills or measures that you hope to advance to directly address the challenges that come with long COVID, greater healthcare needs, long-term accessibility accommodations, funding for research and data collection, or anything else that I haven't mentioned?
Yeah, well, as I so often said and seek to practice every day, the people closest to the pain should be the closest to the power, driving and informing the policy making. And so I really seek to do this work in a way that is cooperative. And I see those closest to the pain as my co-authors in any strategy or legislation that I might pursue. And so my team and I are working actively on this. Earlier this year, we hosted the first virtual roundtable on long COVID and centered the experiences of those directly impacted. So many have been and continue to suffer in silence, their pain dismissed, delegitimized, and ignored. So it was historic and absolutely powerful when President Biden acknowledged the growth of the disability community and how many folks are dealing with long haul COVID, joining just the disability community. And that level of visibility is really a testament to the organizing and the sweat equity of disability justice advocates who continue to speak out in demand of a pandemic response which centers disabled lives. Far too long, this has been dismissed or deprioritized. So we see this now as states led by Democrats and Republicans alike rush to ease COVID-related restrictions. Disabled and immunocompromised folks are going to be most at risk in this dangerous and premature effort to get back to some sort of quote unquote normalcy. So I know that this fight has been long and grueling. So I just want to recognize and give flowers to the activists who helped to put this disability justice issue on the map. and who continue to fight day in and day out for our shared humanity. Again, our destinies are tied. So I'm going to continue working to push the Center for Disease Control on the data front. My legislative director likes to remind me that we have multiple tools in our congressional toolbox. So we are working to engage in oversight work right now to get the data we need, and we'll follow up with legislation on the data side if necessary. So again, that which gets measured gets done. We can't manage what we don't know. So ultimately, where we go from here, will be dictated by what we glean from this data. So we're going to continue to push for that data collection. And based on the conversation that we had and continue to have with impacted folks, we are absolutely working on legislative next steps. I'm particularly concerned about inequities in access to care. The uneven impact of the pandemic will certainly lead to disparities in long COVID. We are already seeing more women of color be impacted. So we need to ensure that folks are able to access care. And we absolutely need to see more research on this. And this will be one of my top priorities as we work to advance any future COVID relief packages in Congress.
I really appreciate you being here. I think we've had a really great conversation, and you definitely have served as an inspiration to us all. And to me personally, as a aspiring lawyer and activist, and just being in this space, seeing you such successful Black women, I really look up to you, and I am really grateful for the opportunity to have a conversation with you today. Thank you again for your time, and I hope that you enjoyed your participation.
I sure did, and I hope you don't mind, since we are still in Black History Month, and Black history is American history, and oftentimes our Black sheroes and heroes, the totality of their identities are not lifted up. So I do just want to say that Barbara Jordan was a Black disabled woman, and Fannie Lou Hamer was a Black disabled woman, and in fact, Harriet Tubman was a Black disabled woman. And so I did just want to highlight that, and certainly we owe all of them a debt. And so thank you for the opportunity to sit at this virtual table with all of you today. Yes, and thank you to our interpreters.
Thank you. So now I will hand it off to Matt, who I'm sure has a few remarks before we transition to panel one. And thank you again, Representative Pressley, and I hope that you have a great weekend.
Thank you. You did a great job.
Thank you.
This is Matt Seeley again. Representative Pressley, thank you so much for joining us. What a way to start off. We're just so excited. And again, what an inspiration and what great words to kick off this event with. We are going to take a break going into our first panel. We'll be back at 1 o'clock to kick that off. But until then, we'll see you then. And again, once again, Representative Pressley, thank you so much. This has really been an incredible start to things. Thank you.
Thank you. It was an honor. Thank you.